Good evening, and thank you for joining us. I'm Jeff Herndon, Public Affairs Officer, and I'll be your moderator for this information session. We know many of you have other things you could be doing right now, so to be respectful of your time, we'll move directly to opening remarks from our Acting Associate Director, Misty Lester.
Good evening. It's my privilege to welcome you to our Choose VA information session. Everyone joined the military for their own reason. Some signed up out of patriotism, others have a family tradition of service, and some just needed a job coming out of high school. There are many other reasons, all worthy in their own way. Whether it was for 2 years or 22 years, serving your nation meant making sacrifices. Some of those sacrifices were monumental and may have included combat. Others seem much simpler, but are just as significant. You missed birthdays and anniversaries. You missed your son's first steps or your daughter's first lead role in a school play. Those are experiences you can never recover. I personally thank each and every one of you for serving. It's a challenging life to navigate because of your service, though, and the sacrifices that you made. Your country offers benefits you rightfully earned through your commitment and dedication. We're about to share detailed information with you about one of those benefits, VA healthcare. We will dispel myths and misconceptions, talk about eligibility, and how to apply. Study after study has shown veterans have better health outcomes when receiving their care through VA, and recent surveys indicate that more than 93% of veterans nationwide trust VA with their health care. I'm proud to say that locally, 95% of veterans trust Dole VA with their care. Part of that is because many VA employees are also veterans. In the VA Wichita healthcare system, including our 5 community-based outpatient clinics spread around the state, over 20% of our staff are veterans. Please listen carefully to the information we're about to share. If you have questions after tonight, we have events around the area between now and August where you can visit with us. Thank you again for your service to our nation. Now we look forward to serving you.
Thank you, Misty. If you have questions at any point during the session, you can submit them in the Q&A. We'll answer as quickly as possible. When asking questions or making comments, please refrain from sharing personal information, whether it be your personal information or that of a comrade or friend. Let me preface this by saying we will not be able to answer detailed questions about individual eligibility. If you tell us when and where you served, we cannot determine your eligibility this evening. You have to submit an application. The Department of Veterans Affairs and the Veterans Health Administration, or VHA, trace their roots to the Civil War. After several rounds of consolidating various bureaus and institutions, VA has officially existed since 1930. With that experience and the wealth of knowledge that comes with it, as Misty said, no one knows veterans better. VA is the nation's largest healthcare system and offers everything from routine checkups to extended care. The Wichita Veterans Hospital first opened in November 1933. It was rededicated in honor of Senator Robert J. Dole in 2002, and we have added 5 outpatient clinics around the state. The VA Wichita healthcare system provides healthcare and other vital services to about 30,000 veterans each year. So let's take a few moments to debunk some myths. I am a veteran as well, having served 22 years in the U.S. Army. So I heard all of these and more before I started working for the Department of Veterans Affairs. I even used some of them myself. You do not have to have served in combat or sustained an impactful injury to enroll for VA healthcare. If you served honorably and met the time qualifications, you are likely qualified for VA care. Changes made through the 2022 PACT Act increased the number of veterans who are eligible for VA care. Not using VA for your health care does not improve accessibility for others. VA staffs every facility properly for the services it offers and the number of veterans it serves. Generally speaking, access is not an issue. If access becomes an issue, rules implemented through the Mission Act of 2018 allow you to get care from a community provider if necessary. It is one of VA's highest goals that you receive the care you need, when you need it, and where you need it. Many of you are young, have a job so you can support yourself and your family, and a benefit of that job is health insurance. You don't have to give up that insurance or any other private health insurance you have to receive health care through VA. You get your VA care and you still have your private health insurance, giving you coverage and peace of mind that most Americans do not get to experience. Many veterans think making too much money automatically disqualifies them for VA care. Income is not the only factor considered when determining your eligibility. There are multiple other factors that are considered. And finally, it is important to know that just because you have a service-connected injury or disability, or just because you retired from the military, does not mean you are automatically enrolled for VA care. No matter your circumstances, you have to fill out an application. So, as a fellow veteran, I have a recommendation for all of you. The application is fairly short and easy to complete. Rather than trying to figure out if you are eligible, just submit an application and let us make that determination. As I said earlier, VA is the nation's largest healthcare system. That means, in many cases, VA has the services you need under one roof. I can sum up this slide by simply saying VA provides you with quality care, cost savings, and lifelong enrollment. An unprecedented number of veterans trust VA with their health care today. I count myself among that 93.6%, and you should too. These next few slides expand on the fact VA healthcare is the largest network in the nation and offers you innumerable benefits and services. When I first started using VA healthcare, I told my provider I'm a former smoker. VA offered me the opportunity to enroll in a lung cancer screening program, and now I get a CT scan of my chest once a year. Through that program, Dole VA alone has detected 123 cases of lung cancer since 2019. 80 of those, or 2/3, were caught while treatable and curable because they were discovered in early stages. You'll be hard-pressed to find a similar program at little to no cost to you. Free hearing aids, free eyeglasses, there are many opportunities to get quality care and save money at the same time. You don't have to be concerned about unexpected big bills because you had to visit urgent or emergency care. A nationwide network of over 3,000 urgent care facilities is available to you. You can see most of your providers virtually from a location convenient for you. You can get your prescriptions refilled by simply replying to a text message. Some veterans qualify for travel reimbursement. I'm not aware of any other healthcare system that provides that benefit. I have mentioned the Mission Act already. VA's community care program ensures, as I said earlier, you get the care you need, when you need it, and where you need it. As Misty said in her opening remarks, you made sacrifices to serve your nation. You earned it, you deserve it, and now is the time to start using it. For the first 3 months of this year, over 100,000 veterans have enrolled for VA healthcare. Why haven't you? To ensure your application is handled as quickly as possible, take a few minutes to prepare. You're going to need your discharge papers. If you can't find them, VA may be able to assist you with locating a copy. Get your most recent tax return, Social Security numbers for you and your family, and documentation of any existing insurance plans you have. Once you have all that together, there are multiple methods available to apply for VA healthcare: online, by phone, in person, or download an application and send it by mail. You may have questions following this presentation, or if you're like me, I prefer that face-to-face interaction to be certain I got everything filled out correctly. We're offering multiple opportunities over the next few months for you to visit with us. We'll be in Salina on April 18th, followed by Hutchinson and El Dorado in May. We then have 3 events lined up for Wichita. You can get more information about all these events on our website. An internet search for VA Wichita will typically get you there, but I'll spell it out just in case. Our website is va.gov/Wichita-health-care. It doesn't take long to find out if you are eligible. I filled out my application on a Saturday, and I was out mowing the lawn the following Saturday when I received that welcome call. After you receive your confirmation letter and handbook, the facility you're assigned to will contact you to set up your first appointment. You don't have to wait for one of our events in order to get answers to your questions. There is extensive information on VA's website. Thank you again for taking the time to join us in this evening's session. We look forward to seeing you in the halls of VA facilities soon.